Hello, today on the Leukopak Lady, I'm talking about a critical topic in allogeneic cell therapy, consenting donors. The ethical sourcing of donor-derived material for therapy development and manufacturing is a foundational aspect of cell and gene therapy. I used to think that this was something easy, that everybody just did correctly, but as I work across the cell therapy space, I see how differently collectors and developers approach this topic. A well-designed consent form and consenting process protects donors, collectors, and developers. The consenting process not only provides transparency, but ensures compliance with regulation and ethical frameworks. Regulatory bodies like the FDA have stringent guidelines around donor consent, including compliance with good clinical practices, ICH guidelines, and requiring IRB review of the consent form. The consent form and all donor-facing marketing materials must be approved by an IRB or an institutional review board before using. The job of the IRB is to review the consent form to be sure all the required elements are in place, that the donor has enough information to make a decision about participation, and that the donor and their information is protected. Some key elements of informed consent of Leukopak donors are explaining the purpose and scope of the collection. So donors must be clearly informed that their Leukopak will be used for research and possibly to manufacture a therapy that will be used in patient treatment. It must include info on whether the cells may be genetically modified, expanded, tested, frozen, stored long-term, and the potential commercial use of the Leukopak. This also includes a discussion that the collector and developer may make a profit from their donation, and a statement that the donor does not have any rights to those profits. And this is a key point for future commercialization of allogeneic therapies. The consent form must include key details on the collection procedures, discomforts, risks, and benefits in enough detail that the donor can make a decision free from coercion. Consenting must also include a discussion of the testing that will be performed on the donor and the Leukopak. To the degree that it is known or reasonably assumed, the types of tests performed should be outlined for the donor, like blood tests for infectious diseases and metabolic markers, genetic testing, cellular characterization, and performance and functional assays, among others. The donor's consent about the testing performed on their cells and DNA is ethical and required. Another important aspect of the consenting is how the donor's data will be stored and shared. This includes test results and demographic information. How will the data be kept private to protect from data breaches? And how will the data be shared with developers in a manner that maintains the donor's confidentiality? The donor's right to withdraw consent from the collection at any time must be included in the consent, as well as the compensation or reimbursement paid to the donor. Some collectors and developers are concerned whether specimens and donor data collected can be shared with third parties. The FDA's revised Common Rule of 2018 states that biospecimens and donor data may be stored and used for future work, even commercial work, as long as the use is disclosed during the consenting process and the specimens are de-identified with no possibility of tracing back to the donor. So this is a good reason why consent should broadly cover use, testing, and data sharing. So all of this that I just discussed barely scratches the surface on this topic. I may do additional videos and blogs on donor consenting in the near future. So on the next episode, I will cover donor eligibility and testing, from FDA requirements to developer requirements.